we have an interesting case. You're a singer, and you used to get those?
Easy. Oh my God.
There it goes.
Sorry for crying.
So I have SHAKURI here today, and we have an interesting case. You came up from Baltimore. You're a singer.
Yes, so I had COVID back in last January. I've always felt sick. I've always felt sniffly, things like that. Always had sinus infections. But then after COVID, it was as if I got a sinus infection and it just never left. And then I got allergies, I got asthma, headaches, really bad headaches in this right side. My ear has been closed for like the last, I want to say 8 months.
Right.
Especially if I fly, we're done for life.
And you have a deviated septum.
Yeah.
You're not getting air through the right side, and you actually have chronic face pain.
Yeah.
So where's the face pain located?
So all here, like, I mean, it's really bad sometimes, as in, you know, I would have to I work remote, but some days I would have to just take a break and just sit, turn off all the lights and not move.
Okay. Do you feel it today?
Surprisingly, no, not as bad. I feel pressure, but I don't feel pain.
Where do you feel the pressure?
Just here. So.
Okay. And it's affected your voice, you said. I don't know all the terminology, but you called it the upper register?
Yes, my head voice, my whistle range, and just anything that uses my nose.
Okay.
And anything that uses my face to sing.
All right.
Let's see. So you see how it gets really hard to push out?
Yeah.
That's kind of what's going on.
Like a scale.
I have to push a little harder to go there.
And you used to get those?
Easy. So it should be able to go in.
But you can't do that anymore.
Yeah.
All right. Let's get started. Scoot forward.
I'm not scared, guys. Well, a little bit maybe.
All right. And I'm going to come up here and get the occiput first.
Oh my God.
There's one.
Oh my God. Okay.
Now you're going to lie on your back.
Okay.
What do you think of that one? Was that crazy? Did you hear that crack?
Wow.
So you're going to help me pass your hair through so it doesn't mess up your hair.
Okay.
Is that okay? Breath in and blow it out.
Wow.
Take a big breath in. Blow it out.
Whoa.
Where'd you feel all that?
All in my... Oh my God.
Help me pass this around your hair.
Sorry.
Careful, careful, careful.
Oh. Oh.
You sore? You okay?
No, I'm okay. I just... You know, you see these on camera and you don't know what...
You don't realize how intense it really is, right? Lie face down for a minute. Good, so take a big breath in. There it goes. There we go. Good. Good, so now you're going to lie on your back.
Okay.
And you also said your right ear was clogged, right? Turn your head slightly this way. You hear it pop? Good. Now we're going to put this behind your head, okay?
It's really hard, isn't it?
Yeah. So I'm going to pull this up, okay? You're going to start on your left side because your right side's the worst of the two sides. This is Floppy. Floppy was my daughter's when she was a baby. And Floppy is now 27 years old.
Oh my God.
And I know that because my daughter just turned 27 and we gave Floppy to my daughter when she was born. So Floppy must be 27. And Floppy is the perfect thing to squeeze. I'm going to place this first on your left side. We always do the good side first because that warms you up and also gets some of the bad side open anyway. So this feels uncomfortable, but once it's placed, we go quick. You're going to take a big breath in and hold it like, it looks like this. Try it. That's it. As soon as your lips touch, I do this as fast as I can.
Okay.
But in the beginning, it takes me a second to place this, okay? So here's the left side, and we're placed. So whenever you're ready, take a big breath in and hold. Did you hear a crack? What do you notice?
Wow. My ear's open. Wow.
Did you hear cracking or popping or separation?
The popping. I heard it here.
Good. You ready? And now we do the right side. Here we go. Big breath in.
Oh my God.
You did it. Here's a tissue. And come sit up. Which side was more intense?
This side, of
Yeah.
course. Ooh.
And did you hear any pops or your ear open up?
My ear opened up a little bit.
Okay.
A little
Good.
bit. Sorry for crying.
Anything else you notice? It's emotional, right?
Yeah, it is.
What's going through your mind?
If I start talking, I start crying a little.
Okay. Your neck is out still. I have to do one spot. Can we do that for you?
Yeah.
All right, lie on your back. Okay, so I'm going to tilt your head a little bit this way. All right, let's do one more. That's good. All right, so now come sit up again.
That's fine.
Now, it typically takes 4 treatments to get maximum improvement, but we can do a lot on the first visit. You want to try your voice right now? Is that a little better?
It is.
All right. So we're going to end there. We put her on the spot with that. It takes a lot of courage to just be here and let someone put a balloon in your face, you know, and then share that. So thank you for being here today.
Wow.
Are you glad you did the visit?
I am.
All right, good.
It's more intense than, I mean, it looks intense, don't get me
Okay.
wrong, but I didn't realize it's very emotional, actually. It's very emotional. So yeah, it's really good. All right, so today's the next day, guys. And it's kind of been a crazy ride, but when I started watching the videos and I decided I wanted to come and do this for myself because of my deviated septum and the fact that I kept having headaches and I couldn't breathe properly. So after one session, the first thing that I noticed when I walked outside in New York City was, wow, everything's really stinky. And because I never actually breathed everything in. Is that the right language? I don't know. I've never actually had a chance to breathe properly in New York City. So the first time that I was able to get oxygen all the way up to my brain, I was like, wow, it's quite stinky in this area. But that's a good thing because that means that I'm breathing properly now. And I hope that will transition to every other part of my career and life. And I'm really, really excited to be on this journey with Dr. Doug and everybody that's here. Thank you.
There it goes.
Sorry for crying.